June is National Men's Health Month, and this morning we are talking about a problem that impacts millions every year: back pain. Dr. Colin Haines is a spine surgeon at the Virginia Spine Institute. Dr. Haines, great to have you back with us on the show. And who's that you got with you?
Nice to see you. So today I'm totally the sidekick. This is the star of the show, Emerson, my 7-month-old daughter.
Oh my gosh, adorable. Congrats on becoming a new dad this year. So tell us.
Well, round 3, so I've got it down a little bit.
I bet you do. Tell us about how back pain specifically impacts men each year, especially fathers.
Yeah, dads oftentimes, I know there's some general changes, but I'll tell you, in my house, I'm typically tasked with doing most of the heavy lifting, whether it's going to the beach, traveling, or even just carrying her around in the zoo. Lots of heavy lifting can be really hard on the back, and that's one of the most common reasons that people come see me in the office is they say, I can't care for my kids or enjoy my kids the way I want to.
So what tips do you have for dads, preventing back pain and lifting things correctly?
Yeah, one of the common themes that we see when people use poor ergonomics, it's forward flexion. It's like doing constant sit-ups. It's actually not good for the back because that puts a lot of stress on the disc, and even Emerson agrees with that one. So what we want to do is use good ergonomics. The old adage, bend with the knees, bend with the hips, it really works, really does.
Oh, okay. We're looking at these pictures, and we can definitely see when you're in a forward position versus where you're in a more straight back position. Carrying a baby, like you've got Emerson in your lap now, but if people carry the baby the wrong way, that could hurt their backs too, right?
Yeah, you want, not only is it fun to hold your child next to your chest, but it's good for your back. If you do a lot of this and hold your child out, it puts a lot of force on your back. Just try it. You really feel it pretty darn quickly.
Yeah.
So you want to make sure you're standing upright with a good posture, good low back curvature. Make sure you hold your child close to your chest.
Okay, close to the chest. Now, what other do's and don'ts do you have for fathers?
When you're a parent, time as well as your body, it's really not your own anymore. I find myself not only not having time to do the type of exercise that I once wanted to, but also, diapers, right? Trying to clean up spit up, dealing with raspberries, all these different things that are kind of hard on your back, In the background, we've got our crib here. I actually elevated the mattress pretty high, so when I'm bending forward to pick her up, I'm not having to do so too far. Same one with changing diapers, using a change table ottoman to do it. Avoid doing that crisscross applesauce and bending forward is good for you.
Oh, okay. Emerson's vocalizing for us.
She's completely on board with these tips, I tell you.
Everybody is loving watching her. She's adorable. So a lot of men tend to ignore persistent pain, and one study shows that 65% of men put off going to the doctor as long as possible. So when should you know it is definitely time to go and see a doctor about back pain?
Yeah, life's too short. I'm acutely aware that as a dad of 3 girls, I've got 3 from 6 years old to 7 months. This may be the best it is. Teenage years may be a little bit challenging. So if you're hurting, don't ignore it. For me, if I'm hurting, I'm not enjoying my children the way I want to, I get it checked out right away because that's the quicker we get answers, the quicker we can get you feeling better.
All right. Well, we appreciate you spending some time, new dad, with us, Colin. And if you want more information, just check out Dr. Colin Haines from the Virginia Spine Institute. We thank you so much for joining us, and say goodbye to Emerson for us. Bye-bye, Emerson.
Bye. Good to see you.
All right. Bye-bye.